Welcome to Electric Evolution with Liz Allan. This podcast explores the transition to net zero and the systems driving real change in how we move, live and power our world. Every week I sit down with the people leading that change, those offering insight, innovation and impact in many ways people don't fully see until they hear their stories. If you're ready for real conversations that inspire action and drive change, please like this video, subscribe to the channel and join us on this journey, and let's cut through the noise and build a better future together. So on my episode today, I've been trying to get her on for absolutely ages. This absolutely stellar woman, Rosamund Adoo-Kissi-Debrah. She is the most amazing woman I've met, and she's the founder of the Ella Roberta Foundation. She also does work for the World Health Organization. She's an advocate for health and air quality, and she does so many things. Rosamund, thank you. I'm absolutely honoured to have you on the podcast. Thank you.
Liz, thank you for having me, and at least I don't have to introduce myself. But hello to all your listeners. Lovely to meet you all.
So I kind of just reminded you, so I saw you for the very first time over 2 years ago at a transport and energy conference up in, I think it was up in Birmingham, and you were being interviewed by Quentin Wilson, and you gave him so much grief. It was hilarious. You were telling him that he'd not connected with you on Twitter, or sort of he'd not followed you on Twitter, and it just made me chuckle. But your story was just, I think there were so many of us in the room that were in tears because of your story. So I do want to talk about that, because this is where your life has come, hasn't it, since kind of losing your daughter Ella.
I mean, 2 years is a long time. Can you believe we've now got a statue to her?
Say that. Sorry.
We've now got a statue to Ella in our local park. So 2 years, it seems like a lifetime away. But yeah, I'm looking forward to this conversation. So now you've told me 2 years. Let's see what I've been up to in the last couple of years since I last saw you.
Yeah. Can we start off by, can you explain about what happened to Ella? And why it's so, the work that you're doing, besides the fact that you've lost your daughter at such a young age, the work that you're doing is so important. So you're in Lewisham, aren't you?
I am, as everyone knows, I love Lewisham. My story really started, it goes all the way back to 2010. I think my life was fairly ordinary up in 2010, although my students might disagree with that, because I used to be head of sixth form, and I used to teach psychology. So I thought we had a pretty mundane life, very similar to everybody else. And suddenly, during the October half term, Ella got what at the time I thought was a cold. And as everyone knows, it turned out to be one of the worst cases ever of asthma ever recorded in the UK. And to cut a long story short, we never during her lifetime found out what the triggers were. So when I say that, by the way, Ella was almost 7. So up until that point, she hadn't had any signs, apart from an upper respiratory infection the year before. There was literally no signs. She was really healthy, and people really struggled to believe this, but there was nothing on her GP records, nothing at all. And I went from October half term to thinking she got a cold to the December of that year, her being in her first coma.
Oh my good God.
So I really didn't have a lot of time at all, and she didn't even have a diagnosis at that point. And that's what I always have to put it in the context for people who say, why didn't you move? I don't know, any house you can sell in 3 months. And anyway, when she first got that cold and they referred her, we were looking at finding out what was actually wrong with her. So moving was not even on the radar. And to be really honest as well, in Lewisham, we live pretty close to our hospital. So it would have been a really difficult decision what to do. So I don't think we would have benefited moving somewhere where the hospital would be like 40 minutes away. She literally wouldn't have made
Mm.
it.
No,
Uh,
no.
so I always have to kind of, when I'm giving myself a really hard time about it. But the problem was we didn't even know what her triggers were. So there was no point moving because
Didn't
the
know,
attack
did you? Yeah, you
would
don't
have
know what
probably.
you don't know.
Well, we now know, don't we, that it was
Mm,
air pollution,
mm.
and it would have been fascinating what part of the UK we could have moved to, which would have been safe, because there's air pollution everywhere, really.
Yeah,
So
yeah.
that there you are. So I just had to get that bit out there.
Mm. No, I'm not so okay, so she had her first coma that the end of that first
Yeah,
year.
December 2010.
And then what happened after that?
And then afterwards, they tried to get her a diagnosis because her asthma was so extreme. They actually didn't think it was asthma. It was that bad that
Jesus.
they thought it might be cystic fibrosis because she used to have lots of mucus and stuff like that. And
Mm.
they tested her for all sorts of things, but it turned out it was just a severe and rare form of asthma.
Oh my goodness. So, okay. So there was obviously some kind of downhill spiral after that point in time then with her.
Yeah, I think when we spoke to Stephen Holgate, who was the expert in Ella's inquest, what he said was that the air pollution was affecting her, but it hadn't manifested and come out the way it actually had up until then, because he isn't able to tell me when her thing really really started, and we don't know for the first almost 7 years what was going on inside her body. We actually do
Mm.
not know, do we? The only time we knew about it is when it actually came out.
Yeah.
So there are some things about her we will never ever ever know. No.
And when was it that you lost her then, Rosamund?
Oh, I lost her in February 2013, so that's been 12 years now. And it's also quite sad the number of children who continued to die or have died since her death. There was recently a child mortality report where 54 children have died linked to air pollution. From 2019 to 2024, and they died from either asthma or anaphylactic. But what's
Mm.
interesting now, all those 54 deaths are linked to air pollution. What I can't tell you is whether there were any more deaths that were not linked to air pollution. So the 54 I'm talking to you about, they were all linked to air pollution, which is interesting.
That in itself just makes you, it's just mind blowing, isn't it?
It
So
is.
when we just going back a step,
Okay.
when we say air pollution,
Mhm.
what specifically are we talking about?
We're talking,
Especially,
yeah, I think we can talk about nitrogen dioxide, we can talk about particulate matter.
mm,
I think we can even include ozone air pollution in that,
mm,
although I'm not sure how much ozone air pollution affects kids here. That's more
mm,
common in places like
mm,
Australia because Australia is really hot. And I think we can talk about sulfur dioxide as well. And
mm,
these are things that don't just happen according to outdoor air, they also come indoors, and they have a lot to do with indoor air as well. Although the air inside our house wasn't the actual issue, it was what was outside. But now, yet again, now we now know more about air pollution, and we know there is outdoor and indoor. And
mm,
one of the things, reason why I'm really talking about indoor air is the mayor of London is hopefully going to be putting very shortly filtration into London schools. So hopefully that will deal with some of the problems of indoor
mm,
air pollution. But I think there's going to be a whole education that needs to be had both about outdoor and indoor air. Indoor air, I've got to be honest, really came on my radar during COVID because we spent
mm,
so much time indoors. So
mm.
I began to be interested about the air we were breathing indoors, and that wasn't much better either.
Oh God. I mean, I suppose I've driven to so I live in Reading and I've driven to Lewisham. I was actually working with a couple of GP practices in Lewisham for a while doing some
Were
improvement
you?
work. Yeah, I'll tell you about that another time. And you might actually even know them. I remember driving up there, and from Reading it's what, kind of 50 miles, but it took me 3 hours to get up because the traffic is just
You're such a champ.
horrendous.
I would have taken the train myself.
Oh, it was easier said than done. There was a lot of stuff I had to take with me, so it's not
Ah,
something you'd log on a train and back.
ah,
But yes, you're right. And actually, from Reading, it was a little bit more complicated.
oh my
But
goodness.
looking at what we're talking about here when we're talking about nitrogen dioxide, sulfur dioxide, and PM 2.5, so particulate matter, we we are specifically talking the outside is pollution from transport, aren't we?
Transport, wood burning,
Mm,
construction, I mean, ammonia even,
mm,
um, because I don't want people to think if they live in the countryside, then air pollution doesn't apply to them. I've got to be very honest about that.
mm,
Although we do focus on urban areas, please don't feel if you live in the countryside, it doesn't apply to you as well. And I try not to exclude anyone from my conversation. It's very
mm, mm,
inclusive because
mm.
asthma is all over. It's one of the, it is the main reason why children in the United Kingdom will miss school due to asthma.
Bloody
So,
hell.
so it is that common. For a period, it had competition with COVID. I do admit,
Mm,
but
mm,
now I think we're back on the asthma trail, and we have a really bad asthma rate in the UK compared to, let's say, Scandinavian countries.
yeah.
And I don't want people to think of asthma as just a kind of little kind of thing. Asthma is a chronic illness, by
Condition.
the way, and there is no cure. So I
Mm,
want people to take asthma very seriously. I think part of the problem is it's so common we don't take it seriously enough, and that might be one of the reasons why children continue to die from it. So for example, right now the sun's out, it's fantastic. However, we've got a very high pollen count right now.
yes.
And one of the problems is, again, hay fever. We don't, I don't know about us, as a nation. Again, we don't take it very seriously. But
Mm,
having uncontrolled hay fever can trigger asthma. So I have to take this bit of our conversation incredibly seriously.
yes.
So if your child has a lot of symptoms of hay fever, please go to your pharmacist and try and get it under control. And it's very debilitating. I've got to say that. But again, people, I don't know, we just don't take it seriously enough.
No, no. And do you know what? Sometimes I think this is to do with a lack of understanding of, like you say, about what asthma is and what hay fever can trigger in people. I get hay fever. My son started with hay fever. Oh, I think it was actually last year or the year before, and he's 19. So, and I was about that age when I started kind of getting I kind of had dust allergies and things like that, that kind of my immune system was a bit chronic at the time. And I did actually have to have an inhaler for a little while, but it seemed to kind of clear up. Not quite sure why,
But
but Reading
by
is
the way,
very polluted.
can I just say the most common form of halogen is dust mites and cockroaches, just so you know. I just thought I should just put that out there.
Dust mites, possibly. I'm not quite sure in Reading we have cockroaches, but
I'm just saying,
I know, I
just in
know.
case
No, yeah.
I have to, like I say, I have to give the facts. Dust
Mm.
mites and cockroaches are the most common forms of halogens. There are loads of halogens, as you know, but those are the most common forms.
Yeah, I mean, I do get quite severe allergic reactions to insect bites and things like that. I come up in big
See,
hives and stuff like that. So yeah, I totally get you. And I'm celiac as well. So
are you?
yeah, that's the other thing. Oh, and it took them a long, long time to actually work that out.
Oh,
So, but
but
so
by
of
the way, can I just say,
course you
this
can.
this isn't like a moan. A third of the nation now, about 20 million people, have allergies now. So this is really, really common. So whoever comes across this, you are not on your own.
Mm.
So about 20 million people now, which is an awful lot. And that's why I want everyone to take this seriously.
Because a lot of people who have hay fever and asthma and things like that will also have another condition as well, won't they?
Very
You
much
know,
so. And that's
possibly
why,
anaphylaxis or something like that. So
yeah,
yeah.
and that's why we should take it very seriously. So people who have food allergies, they also have other things as well.
Mm.
Or if you're like me and my children, we're severely allergic to cats.
Yeah, do you know, it's I have so the animal dander I have problems with as well on certain dogs, not all dogs, but yeah, I kind of
But
do
yeah,
have
and
problems
and,
with
and,
that.
and I really appreciate people who try and hoover if we're like coming round. But I think one of the issues is like when you go into a classroom and you're with 30 other children, if people there have cats, what people don't realise is it can actually stick to people's clothes.
Yeah, it's the
And
dander or the fur, isn't it? It's where I mean, dander is just kind of like it's not like a pheromone or something. Is I can't remember what you call it, but it does stick to your clothes, and it's the same if somebody has peanuts, for example, on an aeroplane, and somebody with anaphylaxis, probably because of the air conditioning systems, it'll kind of pull it in.
by the way, what we're talking about is airborne allergens. That's what.
Mm,
And I think there can be a lack of understanding about it. And I want people to take it seriously. Luckily, most of the time, the issues are resolved. But as we know, sometimes it can be fatal.
yeah, yeah,
And
absolutely.
that's why. But I just think something that 20 million people have, we should be able to openly talk about it. That's how I feel about it.
I
And I
mean,
don't want
yeah,
anyone to feel embarrassed or shy or I mean 20 million, you are one of 20 million people
a
who
lot.
have an allergen. It could be food, it could be dust, it could be pollen, it could be so you are not on your own.
Exactly. And there are lots of cases. I did actually used to do in my previous life. I used to give allergy awareness training to catering
Ah,
companies. So yeah. So when the allergen laws were released a number of years ago, I kind of did allergy awareness training because I myself, it's not as if my son's also celiac, and
oh
it's
wow.
not as if it's not as if we are going to, it's not fatal for us, but people, they need, the catering organisations needed to understand that anybody with anaphylaxis, that would be the case. And that has been the case, and there's a number of court cases that have actually happened since then due to the allergen laws not being adhered to. But listen, let's go back and talk about the what you, I mean, God, I can't even imagine. I don't even want to imagine really what you would have had to go through after losing Ella. But when did when did you decide to start? What was it that made you start kind of, you've now got Ella's law, haven't we? And we've got,
No, we don't have this law yet. We still
right,
come
okay.
back.
Okay. So
We still
you're
confront
you're
that. But by
pushing
the way,
for
I actually didn't decide or make a decision. When Ella was alive, we were trying to find out what her triggers were when she was,
it.
and it just continued. And although she wasn't physically here, I just felt I wanted to continue on that journey. So I never one day said, "Oh, I'm gonna find out." No, we were always looking for what her triggers were
Mm,
when she was
mm,
alive. So no, there wasn't that moment where I suddenly decided that no, we were. That's why we were doing all these tests when she was alive, and it just
mm,
when she died. And even we've got research coming out with Oxford University at some point. We've used her DNA with the twins to try and resolve some questions even now. So the research is ongoing. I never made a decision. But I have to confess, I was ultimately looking to find out what Ella's triggers were. And then
mm,
it turned into this whole thing, if you see what I mean. So I'm not going to pretend that I started off by looking at air pollution. Air pollution wasn't even part of the conversation when
okay.
Ella was alive. It was after the first inquest, and they said her triggers were to do with something in the air, and someone wrote to me to have a look at air pollution, and then that opened. So if you look at my early work, all the stuff I was focused on was asthma, and that's the reason being. And later on, when air pollution came into it, I then made it asthma and air pollution. Otherwise, someone's going to look at it and go, "You never mentioned air pollution in the beginning." No, because we
Mm.
actually didn't know. And you've got to be truthful with people. We actually didn't
Oh
know.
yeah. So okay. Am I right in thinking that she's the first person to have air pollution on her death certificate? But it wouldn't have been that at the time, would it? Because if you're saying that they didn't know that at the
No,
time.
yeah. Nobody in the world, as far as I know, has air pollution on their death certificate apart from her.
Mm.
So it's not just in the UK, it's worldwide. What's really crazy is WHO figures show that 7 to 8 million people die from air pollution every year, annually. And yet, Ella remains the only person to have it on her death certificate. So it's a bit odd, but I will leave your listeners to answer that question, why they think that might be.
But I mean, if we look at, like you were talking about, lockdown, COVID, you
Hmm.
know, back in 2020, and, we didn't have cars on the road, we didn't have trucks on the road, there weren't planes flying, blah, blah. We still had pollen, so there were those kind of airborne allergens and things like that. But am I right there in thinking that the levels of asthma or people who died from asthmatic events reduced during lockdown?
It did, but what didn't go down during lockdown was particulate matter. What went down was nitrogen dioxide.
So the particulate matter was still high then,
Yeah,
even though cars even right. Okay, my goodness. So particulate matter was coming from people. Was that? Are we still talking in outdoor or indoor?
outdoor, outdoor. I wouldn't know anything about indoor,
No,
but
gosh.
outdoor, I'm talking about. Yeah, so if you look at it, nitrogen dioxide dived down, really went down, but PM remained constant.
So what would that have come from then? Because I suppose this is my naivety as well, not understanding where else PMs
I
come
mean,
from other
construction was
than
going on, wasn't it? During,
yeah, yeah, I
yeah.
suppose.
I don't think you will ever get pollution or pollutants down to zero. Not really. I don't think
No.
that's feasible. But yeah,
Mm.
so PM remained constant during lockdown. But so we know that it was the nitrogen dioxide that was really triggering lots of young people off. So when that was removed, yeah, so the prediction we thought was lots of asthmatics would end up going into hospital during COVID. That never happens. No,
Didn't it?
no,
Okay.
no. They were actually better during COVID.
Because the skies were cleaner and I mean I just the roads were clearer and the skies were cleaner and all that lot. And it's still I understand why the government at the time wanted people to go back to work, and but we just feels like we knew we kind of had that period of 2 years, wasn't it? I mean, I know we weren't always in lockdown, and towards the end it was kind of, changing. But we had a period where, and not everybody enjoyed it, but actually seeing less traffic on the road, actually having a health, kind of the health problems, or not, some of the health problems reducing and things like that. And now you've kind of got,
I think some of the downside to that time though was there weren't people diagnosed with asthma either.
mm,
People weren't going into hospital, and I
well,
assume
yeah,
now they've. I don't know whether they've caught up. I better not say that because I might get in trouble with some doctors. But there was an under diagnosis of asthma during lockdown.
so. Because I mean, I suppose there were so many people with COVID, weren't there? And kind of all the pop-up hospitals, like they had the hospital at the Excel for a bit, didn't they? And things like that. So I suppose they had so much on their plate. And like I said to you, we've been working with GP practices, and they're still trying to manage it now, and they're under masses of pressure, and they're not allowed to close their lists, so they've got to keep taking people on, even
Oh,
if
okay.
even if they've got like they're based out of little tiny houses with only so many rooms, they've still got to keep their lists open, which just
Mm,
that's another story entirely. But
yeah. Let's not go there.
no, let's not. There's so much to talk about here, honestly. If we talk about the Ella Roberta Foundation.
Hmm.
So when did you start that?
That was launched on what would have been her 10th birthday. And we launched it in her primary school. And we had the Lewisham NHS choir. They came to sing on the day. I remember it like yesterday.
I can imagine.
It was emotional and it was great. And we also had Millwall football there because Ella loved her football and
Oh,
would have signed for Millwall. So they came as well. And it's amazing to think it is that long ago now. But that was in the right beginning. But we've maintained our relationship with the hospital. I was there recently, giving them some packs for children that come into A&E who are neurodivergent to
mm,
give them things to do whilst they are waiting. Because, yeah, A&E can be quite, as you know,
boring.
the hours are quite
Tedious.
challenging. So, yeah,
That's
so
from a neurodivergent person. Yeah, not the most fun place to be.
yeah, so I was there recently, and we were talking about that. But yeah, so it's a long time ago now, and we never envisaged it would turn into what it's turned into now. Oh God, no. We're still really tiny, mind you. It's me. I have my assistant, the lovely Anna, and Lou, who does my comms, does 2 days a week, and that's it. By the way, so that might explain more why you took so long to get to me because of the kind of workload. But we've purposely I purposely left it being that small because I think it's just something. I feel like if you have more staff, then you have to manage them, and then you don't get to do work like this. So I like it being small. I
Yeah,
feel like we are small but effective.
exactly, and that's the main thing. And you're agile as well, so the work that you're doing is just amazing. So can I just ask you, okay,
Hmm.
if you and I know you've had conversations because because we spoke for ages, didn't we, on the phone a few weeks back, and you've met a lot of people in government, foreign secretary. You've met Chris. You've spoken to Chris Whitty. There's lots of people that you've spoken to.
Hmm.
In an ideal world, what do the government need to be doing, and the health
Oh,
service?
that's really easy. I think there needs to be a public health campaign about both indoor and outdoor air, and I think they need to explain to the public the link between air pollution and non-communal diseases. And what I mean by that is air pollution affects people right from pregnancy. So when they found PM in the placenta, and they found it all the way up to the other end on Alzheimer's patient's brain. There's a link between air pollution and lung cancer, breast cancer, uh, infertility. So it's a much bigger thing. And I think it needs to be owned by the Department of Health, and there needs to be a public health campaign. It's not scaring anyone. It's about giving them information. Obviously, everyone knows about respiratory and asthma, but it's a lot wider. Even COVID in areas of high air pollution, people got COVID more severely. So
Mm,
there's a lot to be done about it. And I think that the government needs to clean up the air. I can't really see how our waiting lists will dramatically drop unless you clean up the air. Because I see people as continuously getting ill. I think you can have more doctors, you can have more nurses, but I think the health secretary needs to adopt a preventative approach rather than early diagnosis, maybe to look at people not getting ill in the first place. That's just my opinion.
oh,
But I'm sure the
yeah.
CMO agrees with me.
Well, hopefully, because I was just thinking then, all of this, you know, anybody who has to go to hospital, anybody who has to stay in hospital or whatever, that is a cost to the NHS, isn't it? That
Of
that
course
is
it is.
that's a cost, and we're talking about millions. If we look at everybody, like you've kind of said the number of people that have got, 20 million people with allergies, for example, and if they're asthma related, or,
Well,
or
some will
whatever,
be. Some will be.
yeah, yeah, exactly. If some of them are asthma related, for example, any of this, if you I just see this as if you provide a public health campaign,
Hmm.
that's conjuring off the cost to the NHS because you're
Who
making
do you
more
think
people
should do?
aware.
Who do you think should do the public health campaign?
I've seen a really, really good video that is it's a GP. Nobody ever gets to see this. It's a GP video, and it's got little kids on it talking
Oh,
about GP practices. And it's kind of, there's a little girl and she's so cute and she talks about the physiotherapist who goes on his bendy bike and stuff like that, and it's just one of those foldable bikes. I think we need people with lived experience.
okay.
You've got to have lived experience, but you've also got to have the other side. You've got to have people who the public trust. Me and you
So,
talked about this,
so
didn't
not
we?
politicians then,
God,
obviously.
no. No, because that's never going to happen. No. Do you imagine? I'm not even going to say because I nearly said something then, but can you
Oh,
imagine
careful
putting,
now,
no, no, I wasn't going to
careful.
swear. I wasn't going to swear, but I was just thinking there was somebody I was thinking, can you imagine the man, the previous with the white
Ah,
hair? Nobody'd go for it. Anyway,
okay.
seriously, no, because we talked about this before, and I know somebody who runs another podcast, Gary Comerford of EV Musings.
Uh-huh.
He's really wanting a similar thing, but for a different reason. So he wants a public health he wants a public health kind of health campaign, sort of, but slightly different, on electric vehicles to help people to understand the reduction in nitrous oxide and PM.
Let's not plug things for Quinton now. Quinton has
No, no, no. This isn't Quentin. This isn't Quentin. This is Gary. This is
uh,
Gary, who's different. But we were talking about people like Jodie Whittaker, Olivia Colman, people who the public trusts. I'm not just
oh,
talking
do you,
influencers.
do you think Olivia Colman would be interested? She's one of my
I'd love
favorite.
to. I know that's why I wrote her down. When we spoke, we spoke over the phone for such a long time, and I've got so many. For those of you watching, these are my notes from when I was talking to Rosamund before. Seriously, I'm just.
She is so good and she's so cool and I
If
absolutely
you've got if you've got Olivia Colman introducing, even just introducing or having a conversation with somebody about their lived experience, because lived experience is the main thing,
okay.
isn't it? I think. But it's also getting people to understand what these things are and what they're doing to people, and even simple things like when you're parked outside a school, don't leave your engine on because you've
Oh,
got
that
little
is
people going
so
past you.
that is just terrible. That is because the pollution in that area goes up by 50%. I don't
Old
really understand
cars,
that.
yeah.
I don't understand people that do that. And also idling is against the law. But I always think that we need to think about other people and not just think about ourselves. Because
Ourselves.
obviously the person in the car is not thinking about the people walking on the street. And that's really, really selfish and that's not cool. That's not cool at all.
Exactly. But in some cases, that NOx is coming through into your car, isn't it? In some
Yeah, but I don't
cases.
think you can ever sell that to people. So
No, no, you
people don't
couldn't.
people
Yeah,
don't want to listen. So let's focus on the people they're poisoning outside then.
exactly. So just even I always talk about it in this way, Rosamund, that I'm from Halifax in West Yorkshire originally. And I remember my mum years ago when I first moved down here in '95. They came down to visit, saying, "Oh, there's not very many chimneys down here, are there?"
What's that?
Chimneys,
Yeah.
as in, kind of. We had lots of woolen mills and lots of different
Oh,
mills, and
okay.
they were spill. Sorry, yeah, sorry. It was buildings that were, kind of working in industry, manufacturing, that were spewing out smoke into the atmosphere. But and they were kind of closed down, really, weren't they? Because actually, people could see that crap coming out of the chimneys. But actually, and I've said this loads of times before on this podcast, people can't necessarily see what's coming out of
Yeah. Oh, it's really
an
weird
exhaust
these
pipe.
days. It's really weird when people say to me things like, "Oh, the air pollution isn't like how it used to be. It was so much worse back in the day." And I'm like, "Well, the problem with it is it's invisible. Just because something's invisible doesn't mean it doesn't exist.
Exactly.
Otherwise, why are there all these diseases linked to air pollution?" That's my concern, the invisibility of it, and people thinking because we can't see it, then it is not a problem anymore.
Yeah, but you can smell it. Most people, like a truck goes past you and it spews out and you can smell it. I've got really strong sense of taste and smell, so I can taste it as well. When you're going past, and I've gone past cars that, or whatever, they're, if they're in a queue or whatever, and I've held my breath, gone, just to try and kind of peg it past the car. But it's trying to get people to understand this, isn't it? And I know that that's what
Yeah,
you
I
want.
think I think the biggest take I want people to take from this podcast is I see air pollution as a health issue. I think that that's my biggest message. I don't really get caught up in all the kind of net zero or the kind of arguments that's going on. I just want people to think about their health. And I know someone will always say to me, Rosamund, but people got to work. But what I do realize is if you're really ill, you can't actually work. Let's just say you've got to get chemo. You won't be at work, you'll be in hospital. So that's what I talk about. This is a real public health crisis that I'm talking about. And it's not scaring people because people who will be listening to this, they have all sorts of illnesses and they know exactly what I'm talking about. And they know how much this impacts their day-to-day lives. They got to ask for time off. Look, there's so many people who actually work with illnesses. That's not what I'm talking about. The fact that they've got to go see their boss, get time off for this, for that, all sorts of stuff. That's what I'm talking about. And we do live longer, but we seem to be living with all these illnesses now. And
Condition.
that's my concern. So for me, this is a real health issue and a public health crisis. And that's why I went to see the health secretary about that. But I don't think it's something he can solve by himself. I think the government, he needs to speak to the transport secretary and he needs to speak to the environment secretary. And I think I would even include the educational secretary involved and even housing. I think all of them need to work together. I don't think this problem can be solved just by one person. That's my opinion. I think they all need to work together. I think, for example, Angela Rayner's brief is housing, but I think I think it matters the type of housing she's going to be building, like ventilation. See, it's
Yeah.
all part and parcel of it. But yeah, let's wait and see. So that's where it brings Ella's law into it. But I would love a situation where they would all get together and work with each other for the health of the nation. That's my ultimate dream. But let's wait and see. I still live in hope.
So go on. Can you give us a bit of an idea about the feedback you got from the health secretary when you went?
Oh, he doesn't disagree with me. He actually thought I was making very strong points, and Sir Chris Whitty was at that meeting. Um, he is doing a 10-year plan, as everyone knows. And let's see whether what I have raised with him, whether that fits into his 10-year plan. Oh, he was very welcoming and very open to what I was saying. But he knows. He knows what I'm talking. He knows what I'm talking about. He
Yeah.
can do his best to bring the waiting list down, but what he can't do is stopping people getting ill. So if cleaning up the air means less people will get ill, it's a win-win for him and for Rachel Reeves as well,
Yeah.
because she must spend so much on, apparently 2.3 million people are disabled. I don't know in what kind of format disability they are, but that's where we are. I think um, I found him very open. He was willing to listen, and he knows this is also an issue of health inequality because depending on where you live as well, there is, when it comes to life expectancy in some areas, the gap is as wide as 10 years. So he needs to do something about that. But I don't think this is a one person job. This is, and I even say that doctors, medics, everyone in health needs to talk out about this issue. Let's wait and see. I think what we need to decide on is what type of public health campaign is going to help. But I do think doctors need to play quite an important role in this. And I feel they need to treat air pollution very similar to how they took on tobacco years ago, and that's what I think. No one's disagreed yet, so let's just wait and see what happens. But I think anybody who wants to come into government, this needs to be something that they are prepared to tackle, and they need to come up with ideas how to solve it. Yeah, so let's wait and see.
I agree with everything you're saying, honestly. And like you said about cigarettes, and I am an ex-smoker of a long, 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 long time ago. But those campaigns of, stopping people from wanting to smoke, people still do, and then you've got the whole vaping thing and everything. But that's something that's really important to get people to recognize. And I also think, and God, this is massive, really. And I know you. If we're looking at net zero, that's not your kind of
No.
focus as such, but if we're talking about particulate matter and everything else that's down to pollution, we're bringing oil and gas into this as well, aren't we?
Yeah, I mean, you won't be surprised that I have spoken to Ed Miliband, and when it comes to air pollution, he's a very well learned man. He knows exactly what I'm talking about, and all I say to him is, when he's out there, obviously, talking about his net zero thing, I need him to talk about air pollution as well.
Yeah.
And as people will realise, even the Foreign Secretary, David Lammy, has been talking about air pollution and climate change. So, but I think rather than just having one-off conversations and stuff like that, I think jointly, all of that, we need to, not them, not asking them to front the campaign, but I think they need to agree with me that the time has come now to have a public health campaign. And doctors will agree with me as well. I don't understand what the hold up is. So maybe someone can tell us what the hold up is. Because every day more people become ill. So I don't really understand that. But I don't run government, so yeah.
And we're lucky that we don't, really. I don't think I'd want to somehow. But I was going to say, either way, there needs to be something that says, did you know that these things make you ill?
Yeah, I think air pollution, both indoor and outdoor, needs to be monitored. Uh,
Mm,
and I'm not saying this, this was what the coroner said. And
mm,
also, there's no point people monitoring it and making it complicated. He said, the coroner has already said this almost 5 years ago now, that they
mm.
need to make the public aware. And I think I don't see any difference for indoor or outdoor. Both need to be monitored and both need to be explained to the public. Look, I think the amount of people suddenly say, "Oh, I've suddenly got stage 4 cancer," and they didn't know about it. Mm. I have my suspicions, but I can't prove anything just yet. So, because I can't prove anything, the only thing I can talk to people about is cleaning up the air, and maybe some of those cases may not happen, but who knows?
Mm. Yeah, I've got a friend who's been diagnosed with stage 4.
And
So,
I'm
yeah,
talking
yeah.
about, by the way, I'm talking about people who have never smoked before. I just
Mm,
want to be absolutely clear on that. So
mm,
I'm not sitting here naively talking about people who've smoked for years. I'm talking about people who don't smoke. Because in India, what's happened there now is 15 years ago, lung cancer was mainly amongst men who used to smoke. And
mm.
in the last 10 to 15 years, it's amongst women who don't smoke. So do you see the change that's happened?
Yeah. Did they live with people who smoked, though, I suppose is the question, because it's kind of that passive
I
smoking,
don't
isn't it?
know, but
Mm.
Dr. Kumar told me a lot of his patients now are women who don't smoke and they've got lung cancer. I'm sure he would have said
Yeah, yeah, yeah,
with
yeah.
people who smoke because that would, yeah. Anyway, let's not dwell on that too much.
No, I get you. I get you. But I mean, this is really important stuff to get the message out there. And I was going to talk to you as well about the fact that, I know you don't travel too much, but
No, I don't.
You went to Colombia, didn't you, for an air quality conference?
Yeah.
Can you give us a little bit of your thoughts on, because your message about Ella, should I say, has travelled the world.
I know, it was so amazing because of COVID. When we won the inquest, we didn't really see how much it really impacted, but it was everywhere in every country. But what was really sad is, and I had mixed feelings about Colombia, is about the lack of action worldwide. In lots of countries, air pollution isn't even monitored. So how would people know what they were breathing? So I came back with a very heavy heart. On the one hand, I was very pleased that Ella's message had got far and wide, but I thought, oh God, a lot more needs to be done. And governments everywhere, they know about air pollution. I don't think there is any government in the world that doesn't know about air pollution. Well, people can let you know, and then you can tell me. They all know about it, and they all know about the impact on health. And I'm really interested why they do so little about it.
So I've interviewed. I think I might have mentioned to you on the when we spoke on the phone before, but I've interviewed Suki Chung, who works for the SMMT, the Society of Motor Manufacturers, and I've forgotten the T. Could be technicians. Sorry if I got that. I know I've got that wrong. But she was previously an air pollution officer for, I think,
So
maybe Wandsworth. So that, there are people in councils even that are doing their best to try and kind of push this forwards. But like you say, it's got to be a concerted effort from many sides. And in some ways, it feels like the private sector's got to be involved as well. It can't just be government. We've got to have buy-in from people who are invested in this. And actually, if you think about a workforce, say you've got like a big corporate with 5,000 people and 10% of their workforce go off sick every year for a period of time, that is impacting them, So,
absolutely, you've got to pick up where when your colleagues are not there, they're not going to employ someone else, are they? You've got to pick up on the you've got to pick up the burden there. But yeah, let's be positive about it because there are many solutions to this. And there are lots of people with skin in the game. We just have to convince our politicians because they think people don't care about this. So that's what I will say to people listening to this podcast, that when you next write to your MP about air pollution, mention Ella's Law, because Ella's Law is all about our human right to breathe clean air. But please let the politicians know that you care about your health and therefore you care about air pollution. Because unless we make a big fuss about this, I feel they're not going to do much about it. And that's where I am with them, really. But I want everyone, and that's why maybe there needs to be a public health campaign so people can suddenly go, oh, this actually affects me as well. I think we need to make a whole fuss about it. Yeah, it's amazing. See, look at what's happened in the last 24 hours when people felt at the last election, which was really interesting. I'm not sure why the migration thing is on everyone's tongue. I'm sure they said the number one reason why people voted the way they did was because of the cut in pensioners thing. But anyway, we won't go on to that. But
mm,
yeah, let everyone know that this is something that you care about. And there needs to be, and I'll continue to push for a health campaign. But I think if people are more vocal about it, and they tell politicians they care about it. If you say to a politician, I'm not going to vote for you unless you do something about air pollution, they actually would.
yeah, but there's got to be a lot of you to act for them to take notice. If you're just one person, but again, it's that concern.
No, because London, in London, it became an issue during the mayoral election, and that's why the mayor did something about it. So there is evidence already there. So we know, and for Londoners, it has been in the top three for the last few mayoral elections, and I don't think Londoners are unique in caring about air pollution. No, I
No, I
don't
mean, if
think
you look at how many low emission zones there are around the country now, you know,
exactly,
you're
exactly.
driving into an area where there's a high proportion of vehicles driving in at one point in
Yeah,
time,
but
and
also,
all of
yeah, I think Liz, I think also we can't have a go at the general population. People need alternatives to take. I
very
met Joanna yesterday. She was on a bus, and I was getting a bus to get to Lewisham, the DLR. And I was saying to her, "Oh, when is the bus due?" Because I couldn't find it on my app. And what had happened to her is she'd been standing there, and the bus before literally hadn't showed up, and she was late. She was late for work.
Oh
That's
no.
so bad for her. Can you imagine getting to work and when your employer says, "Why are you late?" You've got to say the bus didn't show up. I felt so bad for her, by the way. So I think public transport is key, and I think when you come out of London, the public transport is atrocious, and we can't have a go at people in cars until they. People need to get around.
Yeah.
Look,
Yeah.
people need to go shopping. People need to get to jobs. People need to do, and they need to fix the public transport system. I know Andy Burnham has taken over the buses in Manchester now,
Mm.
so hopefully they're going to see an improvement there. But I think some of the solutions are are a lot higher up, and that is governments, the public transport, because how are people going to get to work? How, if where you live the bus comes once every hour, what can I say? So I
Yeah.
don't want this to be a London centric thing. We are lucky that in some parts of London, not everywhere, buses, tubes are very frequent. Where I live, we don't have the underground.
Mm.
And there are some weekends my local train station is closed, it's not working. So you see, suddenly then you realise what it's like for people out of London
Yeah.
all the time.
That's
So yeah,
probably where, yeah, that's probably where I would have got into when I was coming from Reading, and I think that's probably the reason why I decided to kind of drive up there. So I was one of the contributors at the time because I wasn't driving an EV, and so I didn't realize how bad you could just see the.
yeah.
I
So I'm
couldn't.
not really about blaming people. I
No.
think for instance, when I look at Europe, the incentives that they give them to use public transport, I do not see that here. So if people really stop, they should stop trying to make people's life difficult for them, and improve the public transport. And not everyone would take it, but more people would take it, and especially lowly paid people. Buses are crucial. People go, why are you always going about buses? But buses are crucial to
They
people's
are.
lives. Not
Exactly.
everyone can afford trains.
No, oh God, my God, trains are so expensive. I've got friends who wanted to come down from up north recently, and it was looking at like
Oh,
£300
I
for two of
know.
them to come down, and it's not affordable, is it? So you've got to
Sadly,
make these things affordable.
it's cheaper to drive in some cases, isn't it? So it's not that people don't care. People care an awful lot.
Mm,
Let's start by doing a public health campaign, and let's get on about that. And let's see what the health secretary says. I hope someone brings his attention to this podcast. But I think we really, really need one desperately
yeah,
to explain to people what we're talking about.
because like you say, people just go about their own little lives, don't they? Not kind of realizing that what they're doing, whether they're idling somewhere or whatever, whether it has a knock-on effect on someone else's health. But like you say, it's got to be affordable. It's got to be, you've got to provide alternatives. People can't just be buying EVs. I get it. We need to have active travel and kind of probably less cars on the road and more ability to actually be able to get around and things like that. There are ways of doing this. We just need all of these people, government, NHS organisations to come together and do this, don't we?
Absolutely. And I always live in hope that things will get better, and things need to get better.
Mm,
I think when you have children, you must always have hope that things are going to be better for
for
them.
them.
And
Yeah.
but see, they have never been the issue when it comes to this matter. Bizarrely, young people get it. I think it's older people which is the issue here. So let's continue to. I think this is an issue that people were defining yesterday. They were talking about British values. What are British values? And people are having difficulty explaining it. And I think caring about other people, that's what, to me, British values are about, and looking out for other people. That's what I think anyway. When I'm campaigning, I campaign for everybody. So That's why our motto is clean air for all. We don't exclude anyone, but we do realize that the poorest and those who are marginalized, they do bear the burden of this issue. But everyone everywhere is impacted in some form by air pollution.
Yes. And I mean, and to me, for us to do something, it's about, like you've said about with kind of having children. We've got one boy, and I just want to leave the planet in a better place for future, and people's health. I want to make sure that people's health, their health ongoing, we can't just be selfish and just think, oh, well, after we've gone, they'll sort it out. Yeah, right. Actually, it's up to us to be adult here, isn't
Yeah,
it?
yeah. I
Get
think
grown up.
I think people. I think when I'm listening to what's going on, people are already. Although the election is years away, I feel like politicians are already sharpening their knives, looking at what. And I think people need to make their feelings known about this. If
Yeah.
you don't, it's not something they're going to deal with. Um, I think we've been very vocal about the migrant issue. I think people now need to be vocal about health.
If you wanted to leave the watchers and the listeners of this podcast with one thing that you want them to do after they've finished listening and listening to or watching this, what would that be?
The one thing I'd like them to do, as many as many people as possible, is to get in touch with their MP and ask them to support Ella's law whenever it comes back into Parliament. I think that would be the most practical thing to do, because I have heard, word reaches me, that apparently the government think people do not care about air pollution. So you can see why I said that. That's all.
Mm.
And also to also say to people to not give up hope. I want people still to have hope, and I want us to be together on this. There's so many issues where I feel people are on different sides, but when it
Mm.
comes to clean air, it's the one thing I want us all to be on the same page about, because it's about health. And no matter who you are, rich, poor, billionaire, whatever, if your health goes, that's it really. And guess where I actually learned that lesson from? I learned that lesson when Linda McCartney got ill. And I thought, oh
Mm.
my God, Paul McCartney must be a billionaire. And
Mm.
yet he still couldn't save her. So we can be divided over so many other issues. But when it comes to health and the National Health Service, I want us all to be on the same page. So please write to your MP, WhatsApp them, whatever. Speak to people in your local area. Let them know clean air matters, because it is, I don't know. It is linked to so many illnesses now, and I
Mm.
firmly believe that if we clean up the air, okay, put it this way: I met a doctor at the weekend. I'm not going to name her because she told me something personal about her, that she's had breast cancer, that she's okay now, and she is a doctor, and she told me so many more people now are getting breast cancer, and her and I both agreed that from our point of view, having clean air, we don't know whether it is contributing to it, but we believe if the air is cleaner, then there'll be less cancers, basically. 1 in 2 of us apparently will get cancer. And I
Mm.
really believe that if the air is cleaner, then, we will avoid that. So that's all I can say. My hope is we do not allow the politicians to actually divide us on this issue. That's it, Liz. That's all I can ask for. People to write to their MP, to speak to their MP about clean air, and we will do our best to get Ella's law back into Parliament.
Yes, and I'm sorry that I thought it was passed earlier, but yes, that really, really needs to be. We need, like you say, it's got to be a concerted effort for everybody, because everybody,
Everybody,
it affects
because
everyone, doesn't it?
yes,
No matter what the age, no matter what age you are, it affects everybody. And on that note, Rosamund, I'm going to say this has been such an enlightening conversation,
Thank you.
built on a really dark time that I know that you've been through. Like I say, I said to you before, I can't imagine how hard that must have been for you. So just to say thank you for joining me. It's been such a delight and, just a joy to talk to you. And I hope we get to meet properly face to face, because I didn't get to talk to you properly 2 years ago. One day we will hug and, and I'll say thank you properly.
And can I say
and
thank you to your listeners as well? And if you can, kindly share the podcast to as many people as possible, because that's the only way we're going to get the message about clean air out there. And please remember, it is invisible. Air pollution is invisible, and you can't see it with the naked eye. But if you can taste it or smell it, then that should tell you it is there. Thank you, Liz.
Well, listen, to everybody else watching and listening, I'm going to say, as Rosamund's just said, please share this podcast, like, subscribe, do all those wonderful things we need to get these words out. Rosamund's words are so important. Our kids, our families, everybody, it's really important to share this because it matters. It really, really does. So on that note, Rosamund, thank you. I'm going to say to everybody listening and watching, I'll see you next time. Thanks for watching Electric Evolution with Liz Allan. If you've enjoyed this episode, please like this video and subscribe to the channel. If you're a charge point operator, local authority or stakeholder in EV charging, I'd love to talk to you about our Charge Point Evolution framework. It's designed to help you create a seamless EV driver journey, boost utilisation and maximise your return on investment. Alternatively, if you know someone who'd be a great podcast guest or might be interested in sponsoring an episode, you can email me on liz@fullcircleci.co.uk. Thanks again for watching.